So really, if you look at it, these are all various mechanical barriers which will try to prevent the entry of a microorganism in our body. So what does the microorganism want? At the end of the day, it wants to be able to breach through our skin or the mucous membranes, enter our body tissue and really eat it and be happy in there, or circulate in the tissue and do all kind of stuff. So we are trying to prevent that. So the very first thing which we did, we put together a mechanical barrier. So that is like a fort in the old times. When you have, remember we have forts, and these forts have those strong walls made up of bricks and multiple layers and thick layers and so on. And so it is difficult for the invaders to enter through that fort. So our skin layers are an example of those forts. The only fun thing is that within the skin layer, these are not just the surfaces, there are chemical molecules sitting there which are actively causing holes in the bacteria which are coming in, or we'll see that we would have immunoglobulins sitting here. So if I make it with the black marker, immunoglobulin sitting here, which we'll talk more as we continue with the immunology. These are also molecules which can then hang these sad viruses and bacteria. They can keep them away from us. So imagine we have a little stick coming out from the surface, and when the bacteria or the invader is attacking us, we hold it and just keep it over there. So that is another example of a chemical substance sitting on the surface trying to keep the bacteria and viruses away from us. So these are some of the mechanical barrier. Another important thing which we should keep in mind, we are actually inhabited by many of the friendly viruses and bacteria. These are called Normal-flora. So we have a lot of Normal-flora viruses, bacteria sitting in our body. For example, they are sitting in our throat, they are sitting in the vagina, they are sitting in the pulmonary surfaces. And what are they doing? They are occupying this surface, and they are occupying the receptors which could be used by the bacteria or viruses to enter the body. So they are inhabiting, they are covering our surfaces. And that is why sometimes when a doctor uses broad spectrum antibiotics, he or she wipes out those friendly bacteria, and when that area is clean, the opportunistic bacteria or the harmful bacteria, they get an opportunity to quickly invade that area and start entering the body. Another way our body is presenting a mechanical barrier is by providing acidic environment. So what happens is, for example, in the stomach, so let's say this is a piece of stomach surface, we know that the pH here is low. So low pH means acidity. So that is like our body is having an acidic environment for the bacteria and viruses to cross through. So the challenge for them is, for the bacteria and viruses, is to cross through that low pH area. So this is an area filled with secretions which are low in pH. So that would be stomach or vagina. And so when the bacteria tries to enter, he gets coagulated by the acids present here. So many ways of presenting the barrier for the entry of the pathogen into our body. So that is equal to the walls of a fort, which are strengthened, which are bigger, which are thicker, which allow the invaders to stay outside. So that is one. Guys, thank you very much for watching this video. Make sure that you like and subscribe, and if possible, share it with your friends as well.